In terms of implant selection, the first thing I talk to patients about is silicone versus saline. I use probably 95% smooth silicone implants in my practice. In terms of within the portfolio, I actually do talk to patients about projection, and I do talk to them about volume. We kind of work on the volume decision together, and I really do empower my patients to give me a range that they would be comfortable with. So we talk about their goal cup size. I examine the patient. I ask them to bring a picture, because sometimes their vision of a C that looks natural actually is a double D with a really highly projected, up pole.
We then go on to do breast measurements, and I think that this is where the science comes into the surgical approach and to breast augmentation. And I really help my patients understand why measurements matter, why there is certain implants that will and will not fit into their chest, and what the different variety of implants are going to do for them, how that's going to change the look of the implant, the feel of the implant. And I just help them through that process. So we work through that together. We are trying these implants on in the office so they can see themselves in it. Sometimes we'll take pictures of them in their clothes with the different implants on, so that when they go home, they can go back and look through those and remember, oh yeah, that was the difference between these two, and this is why we arrived at that decision. And we oftentimes revisit this. So sometimes when the patients come in for their preoperative appointment, we'll try implants on again, just so they can feel really comfortable in that decision.
I encourage you to try all the different sizes and ignore the number, because a 350cc breast implant on a 5-foot person is going to look totally different than a 300cc implant on a 5'7" person. So ignore the number, try on all the different sizes till you think you're too big, then go all the way down till you think it was too small, and then you can finally break that tie by saying, am I the type of person at 3 months out, am I going to be more upset if I'm too big, or am I going to be more upset if I'm too small? And usually that's a great way to break the tie.
I'm Dr. Essie Yates. I'm a board-certified plastic surgeon located in Fort Lauderdale, Florida.
My name is Dr. Ashley Amalfi. I'm a board-certified plastic surgeon at the Cortellis Center for Plastic Surgery in Rochester, New York.
My name is Dr. Karan Chopra. I'm a board-certified plastic surgeon practicing here in Miami, Florida, and I also have offices in Minneapolis, Minnesota.